I'm joined by Dr. Kate Tulenko. She's the CEO of Corvus Health, a global health firm. And I want to start, Kate, by asking you about these recent testing efforts, control efforts in Qingdao. You know, we always think about testing people, but this is like going at products and pathways. That's important too, isn't it?
Absolutely, because we need to figure out where these infections are coming from. And China thinks that some of their new infections may be imported into the country. And we know that heat inactivates the virus and cold preserves it. So it does make sense that the virus might be catching a ride on this frozen food.
Yeah, it's fascinating. Let's talk a little bit about the vaccines and late-stage trials. Give me your sense of where China is in this race to find a vaccine. How will China handle distribution? And, you know, just listening to that story, you're hearing that, you know, these mild symptoms, I think, you know, pain, swelling, I think of people who've gotten the shingles vaccine, that's kind of common. So I don't see this as a big deal, but I want to get your thoughts.
Right. Well, you know, they're comparing this against the placebo where they inject sterile water, basically. Well, anytime you have a live vaccine, and China's vaccines are a live vaccine, you're going to have some people who have fever, just a natural reaction to a minimal viral infection. So that's not a concern at all. And China certainly is the first country through emergency use authorization to be vaccinating people with the vaccine. They started first with the Chinese military, and now in provinces like Zhejiang, they're vaccinating health workers and port workers and people who are in contact with folks who've come in from abroad. And they're doing this through their local CDC system, their local clinics. And this is the regular pathway that Chinese uses to immunize people. So we think that this might be the rollout pattern that they use for the rest of the country.
Yeah, and there's this program known as the COVID-19 Vaccine Global Access Alliance. It was launched by the World Health Organization. That happened in April. China's in, the U.S. is not. Explain to us why that's an important distinction to be made, and what's in it for China, and why do you think the U.S. balked?
Well, I think, you know, for the U.S., it wanted to make sure that it had enough vaccine for its population. The U.S. does have the #1 number of cases of COVID in the world, so I think that was a concern. And China certainly is looking at its economy and making sure that the supply chains are intact. And, you know, if the countries they trade with have a lot of COVID, it's difficult for their economy as well.
So talk to me about your sense, because we keep hearing, you know, these different dates. It's like throwing darts at a dartboard. Given, you know, somebody like yourself who understands all of this, and I think the lay people do not, we feel like there's these advances being made, but it's a long, arduous task, isn't it? I mean, when can we look for a vaccine, do you think?
Yeah, I think we won't see large-scale rollouts until the second quarter of 2021, because four things need to happen for a vaccine to be rolled out. The clinical trials need to be completed, the phase 3 clinical trials with enough people to show that the vaccine is safe and effective, and then the regulatory agent needs to approve it. You need to manufacture enough vaccine, enough needles, enough vials, and then you need a pathway to immunize people. You need the mechanism to roll it out. So we need to have those four things in place. And most countries probably won't have this really until, I would say, the late spring of 2021.
I know you touched on it, but I'd like to talk a little bit more about what's happening in Zhejiang, this vaccine pilot program, as you were talking about. You know, it's going for medical workers and that sort of thing. Clearly, it's a pilot program. It gives them kind of a grounding. How do you roll all this out? But when you look at the immensity of how many people there are in China, and not just China, but the world, everybody needs this vaccine. That's also going to be really tough, isn't it?
Yes, it is, and it's going to take a lot of logistics and also manufacturing all the other elements that you need for a vaccine. Once again, we have to remember it's not just the vaccine. It's, you know, having the vials. There might not be enough glass vials in the world to vaccinate all the people, all the needles, all the Band-Aids and bandages that you need. So it really is going to be an incredible logistics effort and a manufacturing effort to make sure everybody can get vaccinated.